Welcome to a presentation about hip pain brought to you by your neighborhood doctors. Please remember that we will cover the topic in general terms. Please consult your doctors for specific questions pertaining to you. Hip pain can be compared to a car that needs an oil change. When the car is running low on oil, it starts to make strange noises and eventually stops working. Similarly, when the hip joint is not properly lubricated, it can start to make strange noises and eventually stop working. The lubrication of the hip joint is essential for proper movement and function. Without it, the hip joint will become stiff and painful. Just like a car needs an oil change to keep running smoothly, your hip joint needs proper lubrication to stay healthy and pain-free. Hip pain can present itself in a variety of ways. Common symptoms include sharp or dull pain in the hip area, which may be localized to one side or spread across both hips. Pain that worsens when you move your hip, such as when you walk, climb stairs, or stand up from a seated position. Stiffness in the hip area that makes it difficult to move your leg. Swelling and tenderness around the hip joint. A grinding sensation when you move your hip joint. Weakness in the muscles around the hip joint. Hip pain can affect people of all ages, genders, and backgrounds. It is most common in adults over the age of 50, but it can also affect younger adults and even children. Women are more likely to experience hip pain than men, especially during pregnancy or after childbirth. People who are overweight or obese are also more likely to experience hip pain due to the extra strain on the joint. People who participate in high-impact activities, such as running or sports, may be more prone to hip pain due to the increased stress on the joint. Additionally, people with certain medical conditions, such as arthritis or bursitis, may be more likely to experience hip pain. Hip pain can be caused by a variety of factors. It can be caused by an injury, such as a fall or a sports-related injury. It can also be caused by overuse, such as from running or other activities that involve repetitive motions. Arthritis is another common cause of hip pain, as it can cause inflammation and stiffness in the joint. Other causes of hip pain include bursitis, tendinitis, and muscle strains. In some cases, hip pain may be caused by an underlying medical condition, such as an infection or a tumor. Treatment for hip pain depends on the underlying cause. Generally, treatment involves rest, physical therapy, and medications to reduce inflammation and pain. In some cases, surgery may be necessary to repair or replace a damaged joint. Rest is important for reducing pain and inflammation. You may need to limit activities that cause pain or discomfort in the hip area. This could include avoiding certain exercises or activities that put strain on the hip joint. Physical therapy can help strengthen the muscles around the hip joint and improve flexibility. Exercises may include stretching, strengthening, and range of motion exercises. Your physical therapist can also provide guidance on how to modify your daily activities to reduce stress on your hips. Medications such as non-steroidal anti-inflammatory drugs, NSAIDs, can help reduce inflammation and pain in the hip area. Your doctor may also prescribe corticosteroids or other medications to reduce inflammation and relieve pain. In some cases, surgery may be necessary to repair or replace a damaged joint. Surgery is usually reserved for severe cases of hip pain that do not respond to other treatments. The prognosis of hip pain depends on the underlying cause. In most cases, hip pain can be managed with rest, physical therapy, and medications. If the underlying cause is an injury or arthritis, the prognosis is generally good with proper treatment. However, if the underlying cause is a more serious condition, such as a tumor or infection, the prognosis may be more guarded. In these cases, further testing and treatment may be necessary to determine the best course of action. Thank you for listening to this presentation brought to you by Talking Raymond. For information, check us out retinally.com/info. Be safe. Love you.